Two people can say joint pain and be talking about totally different problems. One person wakes up with stiff hands in the morning, like the joints are a rusty hinge that needs time to loosen. Another person gets a sharp flare in the elbow after activity, more like an irritated rope that hates being tugged. And both of them end up in the same place, a supplement aisle scanning bottles, hoping an anti-inflammatory herb will be the missing piece. That is why so many anti-inflammatory herb videos disappoint. They treat pain like one lock with one key. Different locks need different keys. In this video, you will learn a simple pain plant map with 4 patterns: inflammatory joint stiffness, tendon or overuse flare-ups, muscle tension soreness, and nerve-like pain. For each one, we will talk about what it feels like, what people commonly try, which plant categories tend to match that pattern, and what can backfire. This is educational, not medical advice. No dosing instructions and no cure claims. Research is mixed from many plants, quality varies, and individual responses can vary a lot. The goal is clarity and safer experimentation, not hype. Before any plant talk, we need a safety layer. Picture a checklist next to a calendar, a pill organizer, and a journal page. First, if you are on medications or managing a chronic condition, it is smart to run herb ideas past a clinician or pharmacist. Interactions are real, and they are not always obvious from a label. Second, be especially cautious if you take blood thinners, anticoagulants, or antiplatelet medications, or if you have a bleeding disorder. Many commonly discussed anti-inflammatory plants can potentially add to bleeding risk in some people or interact in ways that matter. Third, if you are managing blood sugar with diabetes medications, be cautious. Some commonly used plants can affect blood sugar, and the combination can be unpredictable. Fourth, pregnancy and breastfeeding are a separate category. Many herbs have limited safety data there, and natural is not the same as proven safe. If you have upcoming surgery, this is a big one. Bring supplements and herbs up with your surgical team well in advance. Some products are recommended to be stopped before procedures because of bleeding risk or anesthesia interactions. Finally, the safe start rule. One change at a time for a short window with short notes. If symptoms worsen, stop. A simple journal page with a few lines can protect you from weeks of confusion. Now, the pain plant map. Pattern A is inflammatory joint stiffness, the rusty hinge feeling. This tends to feel like morning stiffness that eases with movement, achy joints that can feel warm, sometimes swelling, and a deep soreness that is less about one sharp motion and more about a general inflamed feeling. Think of an arthritis X-ray image and those stiff hands in the morning opening and closing slowly. What do people commonly try? Usually a headline herb they have heard about, sometimes in capsules, sometimes in teas, sometimes stacked with several other things. The problem is that stacks blur the feedback, and the wrong match can disappoint. Commonly discussed examples for this pattern include turmeric, or curcumin, ginger, and boswellia. Turmeric and curcumin are often discussed in the context of joint comfort and inflammation signaling, but research is mixed, and absorption and product quality vary. The key caution is interactions and bleeding risk, especially for people on blood thinners or with upcoming surgery. Also, some people notice stomach upset, and that matters. Ginger is also commonly used for inflammatory comfort. People use it as a tea, in food, or as supplements. The caution here is similar. It can be more active than it looks on paper, it can bother sensitive stomachs, and it can overlap with medications in ways that are worth checking. Boswellia, sometimes described as frankincense extract, is another commonly discussed option for joint stiffness. The caution is variability, different extracts, different concentrations, and different personal response. If you're on medications, it is still a check-first category. What can backfire in this pattern? Expecting a fast, pain-erasing effect. Many people do better when they treat these plants as part of a broader plan and track what changes rather than chasing an overnight flip. Pattern B is tendon and overuse flare-ups, the irritated rope. This feels sharper and more mechanical. A tendon often hurts with specific movements. It can flare after activity. It might show up as runner's knee, tennis elbow, or that one spot that complains every time you load it. Picture a tennis elbow strap, a runner's knee brace, and physical therapy bands hanging on a door. Here's the uncomfortable truth. With tendon pain, load management and recovery basics often matter more than any supplement stack. If the irritated rope keeps getting tugged the same way, a plant product is not going to outvote the mechanics. So what do people commonly try anyway? They often try comfort-focused approaches, frequently topical. Commonly discussed topical options include arnica products, comfrey topical gels, and topical capsaicin. Arnica is commonly used topically for a bruised or sore feeling. It is not a magic fix for tendon structure, but some people like it as a comfort tool. The caution is skin sensitivity and product quality, and it is generally framed as external use. Comfrey is sometimes discussed in topical preparations for joint or tendon discomfort, but keep the framing strictly topical. People should be cautious about internal use discussions because of safety concerns. With topicals, the caution is still respect the label, watch for skin reactions, and do not treat it like a cure. Topical capsaicin creates a warming, sometimes desensitizing sensation. It is commonly discussed for certain pain patterns, but it can backfire if you apply too much, apply it too frequently, or touch sensitive areas. It can feel surprisingly intense. Wash hands, avoid eyes, and treat it as a tool that needs respect. If tendon pain is persistent, worsening, or associated with weakness or loss of function, that is a cue for evaluation. Tendons can need specific rehab approaches, and ignoring that while stacking remedies can delay recovery. Pattern C is muscle tension and soreness, the tight cable. This is the place of stress-related muscle tension. This is tight shoulders and neck, the soreness that feels like you are carrying tension in your muscles all day and trying to sleep it off at night. Picture stretching in a quiet room, a warm compress, massage oil, and bath steam. Tight. This is where many anti-inflammatory conversations get fuzzy, because muscle tension relief is not the same thing as reducing inflammation. Sometimes what people need most is a calming cue, a circulation cue, or a sensory cue that tells the body it is safe to soften. Calming. Plant-adjacent comfort approaches people commonly use here include topical peppermint or eucalyptus rubs, rosemary-infused oils, and soothing wind-down routines involving chamomile or lavender. Peppermint. Peppermint and eucalyptus topicals are often used for a cooling sensation. They can feel refreshing and can help some people with the perception of tightness. The caution is skin sensitivity, especially if you use concentrated oils. Sensitivity. Rosemary-infused oils show up in traditional topical use for sore muscles. Again, the caution is skin tolerance and not using strong essential oils undiluted. Tolerance. Chamomile or lavender often appear here not as anti-inflammatory cures, but as part of a wind-down routine. A calm tea, a steady bedtime ritual, and a nervous system that gets consistent signals. Think an organized pantry herb shelf and a simple evening routine. The backfire here is expecting the tea to do what the routine does. The plant is often the signal, not the whole solution. Pattern D is nerve-like pain with burning to tingling and shooting sensations. This is the category where we slow down and get serious, because these symptoms often require medical screening sooner rather than later. Picture a nerve diagram, a tingling hand, a back pain silhouette, and a clinic waiting room. Nerve-like pain can show up as burning, pins and needles, electric zaps, shooting pain, or numbness. This pattern has red flags. If you notice weakness, spreading numbness, sudden changes, fever, unexplained weight loss, or severe night pain that does not let up, get evaluated sooner rather than later. We keep plant talk minimal here, and we frame it as comfort only, not a fix. One commonly discussed comfort option is topical capsaicin for certain sensations. It can change the way pain signals are perceived at the skin level for some people, but it does not solve the underlying cause. It can also backfire if overused or applied carelessly. In this category especially, the priority is figuring out what you are dealing with, not stacking remedies. Now let's talk about the stacking trap, because it's the fastest way to get confused and increase risk. A lot of people stack turmeric, ginger, willow bark, multiple creams, teas, and a couple of mystery blends all at once. Then they can't tell what helped, what did nothing, and what caused side effects. Picture a messy supplement pile next to a simple checklist. Stacking can backfire in two ways. First, you lose signal. Second, you increase risk, especially when blood thinners or surgery are in the picture. Willow bark is a common example. It can overlap with medication considerations and side effects. If you're already using medications that affect bleeding or stomach lining, adding more pain relief ingredients can be a real problem. The method is simpler than the marketing. Pick the category that matches your pattern. Choose one change. Track pain, sleep, and mood briefly using phone notes or a journal page. And stop if symptoms worsen. If it feels like a rusty hinge with morning stiffness, warmth, or swelling, people commonly discuss joint comfort categories like turmeric or curcumin, ginger, and boswellia, and you should use caution around medications and surgery planning. If it feels like an irritated rope, tendon, and overuse pain that flares with movement, relief is often topical, but the real foundation is load management, recovery, and evaluation if it persists. People commonly discuss arnica, comfrey in topical preparations, and capsaicin used carefully. If it feels like a tight cable, muscle tension and soreness respond to sensory and routine-based approaches. Many people use cooling rubs like peppermint or eucalyptus, rosemary-infused oils, and calming wind-down cues like chamomile or lavender without treating them as inflammation cures. If it feels nerve-like, with burning, tingling, or shooting sensations, prioritize screening and watch for red flags. Keep plant options minimal and comfort only, with cautious topical choices like capsaicin for certain sensations. Choose the category, not the hype. Different locks need different keys. And if pain is persistent, worsening, or interfering with life, the safest next step is getting a clearer diagnosis and guidance, especially if you are on medications or managing chronic conditions. If you want more evidence-first content like this, subscribe for remedy autopsies, safer experimentation frameworks, and single-plant deep dives that separate what is commonly discussed from what is actually known.